Coronary artery disease or CAD, also known as ischemic heart disease, is one of the most common heart conditions. It happens when fatty deposits called plaque build up in the arteries that carry blood to the heart. The buildup can slow down or block blood flow, which can lead to chest pain, shortness of breath, or even a heart attack. Coronary artery disease is one of the leading causes of death worldwide and is expected to become even more common. It's caused by a mix of genetic and environmental factors and involves long-term inflammation in the heart arteries. Over time, the arteries may narrow or change shape, making it harder for blood to flow. Several things that damage the blood vessels walls, like high cholesterol, high blood pressure, smoking, diabetes, inflammation, or family history of early heart attacks. Coronary artery disease starts when the walls of your blood vessels don't work properly. Fat and cholesterol begin to build up, causing inflammation and triggering your body's immune response. Over time, plaque forms in the arteries. If the plaque becomes unstable or breaks, a plaque clot can form. This is called thrombosis. If the artery gets completely blocked, it can stop blood flow to your heart and cause a heart attack. Symptoms of CAD includes chest pain, shortness of breath, fatigue, headache, dizziness, weakness, discomfort, pressure, radiation to jaw, shoulder, back, or arm. Doctors use exams, heart scans, ECGs, and stress tests to check for heart disease and decide the best treatment, sometimes using medicine or detailed imaging if needed.
Coronary artery disease, or CAD, is one of the leading causes of death worldwide, but the good news is that many of the risk factors are actually preventable. Let's start off with what we can control. High blood pressure or hypertension is a major risk factor. It often increases between ages 30 and 65, putting you more at risk of CAD. High cholesterol, especially high triglycerides, is also a big concern as it is the second most common risk factor for CAD and raises your risk by over 50%. Having diabetes is even more dangerous as your chance of heart disease is 2.5 times higher if you're a man and 2.4 times higher if you're a woman, compared to someone without diabetes. Obesity is another major concern. Being obese can double your chances of developing CAD, and smoking can increase the risk of CAD by 51% if you have diabetes as well. Even being around secondhand smoke can increase the risk by up to 30%. Then there's diet and exercise. Diets high in processed foods, saturated in trans fats, sugar, and soft drinks increase your chances of CAD. However, if you stay physically active, you can reduce your risk, while being inactive raises it by over 12%. Now, there are some risk factors we can't change, like age, gender, ethnicity, and family history. The older we get, the more risk increases, as CAD prevalence increases after 35 years in both men and women. Men over 40 have a 49% lifetime risk of getting CAD, while women face a 32% risk. Men tend to be at higher risk than women, and some groups like Black, Hispanic, Latino, and Southeast Asian populations are more likely to be affected. If heart disease runs in your family, especially in people under 50, your risk is even higher. So what can be done? Lifestyle changes like eating healthier and exercising regularly are important. Medications like statins and beta blockers help manage the condition. In more serious cases, procedures like stents or heart surgery may be needed. But untreated CAD can lead to heart failure, irregular heartbeats, or even sudden death. A heart attack can shorten your life by over 16 years, and heart failure by almost 10. It can lead to poor quality of life and is a very serious condition, as 120 lives are being lost every day from heart-related diseases. But with the right steps, it can often be managed or even prevented.
Successful management of CAD requires particular attention to physical activity, dietary habits, and emotional well-being. According to the American Heart Association, the recommended amount of physical activity for patients with CAD is at least 150 minutes per week of moderate intensity physical exercise. It is important to begin with low intensity physical activity like walking or cycling, gradually increasing the duration of the intensity of the workouts. Also, light strength workouts should be introduced in the routine, such as body weight and resistance band exercises. Adhering to the physical activity recommendations has shown to reduce systematic inflammation, stabilize fatty plaques, and enhance oxygenation of the heart muscle. Therefore, compared with always inactive patients, those who started to introduce minimal physical activity into their routine have seen a 45% less risk of all-cause mortality in the 15 years of follow-up, as well as a significant improvement in health-related quality of life. The main dietary goals for patients with CAD include limiting saturated fatty acid and trans fatty acid intake to not larger than 10% of the total energy intake, as well as sodium intake to 2,000 milligrams. Primarily, an excess in saturated and trans fatty acids leads to raised levels of LDL, thereby accelerating atherosclerosis by promoting systemic inflammation. while excess sodium increases blood pressure, thereby worsening vessel health. A convenient and effective way to modify a patient's diet with CAD is following the recommendations of Mediterranean diet. Substitution of saturated fat with monounsaturated olive oil, high in sodium processed meats with seafood and legumes, as well as absence of discretionary foods, has shown to significantly improve long-term health in patients with CAD. Last but not least, a holistic approach that prioritizes mental well-being in treatments of CAD is important, as poor well-being is shown to worsen long-term trends in patients with CAD. Research shows that depression is significantly associated with CAD and higher all-cause mortality in patients with CAD. Specifically, depression and anxiety in CAD patients have shown association with increased levels of pro-inflammatory cytokines and sustained stress activation of the nervous system, leading to plaque instability and worsened blood vessel health. Behaviorally, depressive mental states lead to risky behavior, such as smoking, alcohol use, and physical inactivity. To mitigate these effects of poor mental health and CAD prognosis, family and social services support is recommended, whereas in severe cases, cardiac rehabilitation programs show greater effectiveness.
Living with CAD doesn't mean you have to face it alone. There are many resources available to support you on your journey. For reliable information about CAD, you can visit the Heart Foundation website or the Heart Research Institute. These organizations provide up-to-date information about heart disease, treatment options, and lifestyle changes. Support groups can also be incredibly helpful. Connecting with others who understand what you're going through provides both emotional support and practical advice. Your local hospital likely hosts heart health support groups, or you can find online communities through the Heart Foundation. When visiting your healthcare team, it helps to prepare questions in advance. According to the Australian Cardiovascular Health and Rehabilitation Association, informed patients who actively participate in their care experience better outcomes. Some questions that you could ask include, what lifestyle changes will help my specific condition? How can I tell if my symptoms are getting worse? What side effects might my medications have? And what warning signs should prompt me to seek immediate help? Keep a journal of your symptoms, questions, and concerns between appointments. The AHA recommends symptom tracking as it helps you have more productive conversations with your healthcare team and improve symptom management. Let's review what we've learned so far about CAD. CAD develops when plaque builds up in your coronary arteries, restricting blood flow to your heart. Common symptoms include chest pain, shortness of breath, and fatigue. Risk factors include high blood pressure, high cholesterol, diabetes, smoking, and family history. Treatment involves medications, possible procedures, and lifestyle changes. Regular physical activity, heart-healthy eating, and emotional well-being are essential for management of CAD. After being diagnosed with CAD, working with your healthcare team to create a management plan is essential. Your plan should include a medication schedule, regular checkup appointments, cardiac rehabilitation if recommended, gradual lifestyle modifications, and emergency contact information. Setting realistic health goals is important. You should start small and build gradually. For example, begin with short 5-minute walks and increase it by a few minutes each week. Make one dietary change at a time, like reducing salt or adding more vegetables. Work on stress management techniques for a few minutes daily. Building your healthcare team is another important step. Research shows that multidisciplinary care improves outcomes by coordinating different aspects of your treatment. This team might include your primary care doctor, a cardiologist, a dietitian for nutrition advice, a physiotherapist or exercise specialist, and a mental health professional if needed. Remember to be an active participant in your care. Ask questions, share your concerns, and be honest about any challenges you're facing with your treatment plan. Remember, a diagnosis of CAD is not the end of your story. It's an opportunity to take control of your health. Studies show that patients who implemented recommended lifestyle changes after diagnosis had up to a 45% lower risk of mortality compared to those who remained inactive. With the right support, a positive attitude, and commitment to your health plan, you can successfully manage your coronary artery disease and enjoy a good quality of life for years to come.